Good morning and welcome to the East Tennessee Report. The East Tennessee Report is a public affairs program of the Summit Media Corp Knoxville Radio Group. I'm Kim Hansard. This morning we're going to be talking with Jennifer Tourville, DNP, CPNP, Clinical Assistant Professor, UTK College of Nursing, and Director of Substance Misuse Outreach and Initiatives for the UT system. Wow, Jennifer, that's a mouthful. Good morning.
It really is. Good morning. Good morning.
I think what that all boils down to is you're kind of an expert on the misuse of substances here in our area.
Yes, I am.
Okay, so let's talk a little bit. I think all of us know that we have a real problem here, in particular when it comes to opioids and the misuse of them here in our area. Why do we have such a problem with this?
Well, Tennessee, when opioids were first being prescribed and they were being overprescribed and there were unethical prescribing practices, Tennessee was one of the states that had the highest rates of opioid prescriptions per person in the United States. For a couple years, we were number 2 and number 3 in the country. So there's a lot of prescriptions that were written, and a lot of people became addicted to opioids. And now we're seeing the consequences that follow that.
Well, now, we hear a lot, like if you listen to news reports and see stories on this, we hear a lot about opioids coming out of Florida. But, I mean, for us here in East Tennessee, it's like, we don't know about that. We just know about here. Why is Florida talking about so much when we have such a problem here?
Well, what's happening is we're having synthetic opioids come in from other countries, and they're coming into some of the other states and then are being distributed across the country. So we're seeing what's causing a lot of overdoses right now is fentanyl, which is a synthetic opioid that's 50 to 100 times stronger than morphine. So it's coming in from Mexico and it's coming in from China. So it's coming into Florida, but then it's being distributed across the country.
So that's why we hear about Florida so much when actually, it's ending up here. Now, does our locale have something to do with how we get so many here in this area? Because of, we hear so much about the interstates intersecting and all that stuff. Is that why we're such a hot point for it?
The Appalachian areas are really such a hot area. That's where the initial opioid crisis hit the hardest, and that's where we have the most people with addiction. So those are areas where there's a lot of buyers, if that makes sense.
Yeah.
So, it's a supply and demand. So there's a big demand for it in this area. So it's coming in from all areas to meet that demand.
Now, I am sure that people who are listening this morning and have taken opioids or any kind of painkiller in particular are thinking, if they've not had an addiction and not had a misuse issue with it, are thinking, oh my goodness, I can take, one of these pills and it puts me out for hours, and we hear about people who are taking, 10s and 20s a day to support their habit. And you had touched on, Jennifer, the misuse and the the overprescribing. How does that even get started? I mean, doctors, do they mean to, or is it just something that they fall into?
So it really started more with the pharmaceutical companies and the marketing, the over-marketing. And physicians weren't aware of how addictive it was to start. And some of them knew it was addictive, but were getting incentives from the pharmaceutical companies and unethically prescribing. So I don't think everybody intended for this to happen. It was the pharmaceutical companies, some unethical practices, and it just kind of snowballed.
Mm-hmm. And then here we are, we're the hot spot in the world, it seems, and everybody's talking about us. And I think all of us at this point, probably most people listening, know someone who has had an issue with some kind of opioid. It's sad but true. We used to talk about things like diabetes and cancer. Well, we all know somebody who has one of these health issues, and now it's become opioid. So what do you, as the Director of Substance Misuse Outreach and Initiatives for the UT system, do to try to get us back where we need to be and to fix this problem?
Prevention is really the most impactful tool that we have.
Mm-hmm.
But prevention that takes place on the front end, and now we're in this problem, and we need the treatment and the recovery resources. What we're dealing with right now is an increase in overdose deaths. So that's where we're trying to focus a lot of efforts. With the pandemic, addiction is a disease of isolation. So when the pandemic hit, we started seeing a big increase in overdose deaths. So right now, we're trying to focus on keeping people alive and treatment and recovery, but prevention is really where we're going to make a difference in the long run.
But like you said, we have so many people right now who just need the help staying alive and hopefully reversing or at least coming into some kind of recovery from the addictions that they have. And I know we hear so many things. This pandemic, I know it's hard to believe that some good things have come out of it, the way we do things and systems. But when it comes to mental health and addiction issues, it's really hit us hard as a nation and here in our community. So we hear a lot about Narcan, and I know that's something that you work with quite a bit. Tell us what Narcan is, because I know we're hearing it more and more in news stories, and how it is saving lives. So talk to us, Jennifer, about what Narcan is.
So Narcan is the name brand for a medication called naloxone, which is opioid overdose reversal medication. So what it does is it binds to the opioid receptors in the brain, and it will reverse an overdose. It can be given by anybody to anybody. If you don't have opioids on board, there's no side effects to it. It's not going to hurt you. So we're trying to get it into the hands of everybody that uses drugs, family members of people who use drugs, anybody that we think might come into contact with somebody that needs overdose reversal medication.
Now, some people obviously know that they have a loved one or relative who has an issue with opioids. But what are some signs that if you don't necessarily know someone who has obvious signs of addiction and obvious issues, how do you know you even need this?
Well, I think everybody needs it. I keep it in the glove box of my car. You never know when you're going to happen upon somebody that's having a health crisis. And now, first thing to do is the AED, which we all know. Second thing to do is to give opioid reversal medication. So I think everybody needs to carry it just in case. It's easy to carry. You can get it for free. It's easy to administer, and you have it if you need it.
And there's something, I bet a lot of people right now are going, wait a minute, what? We can all have this at the ready. So if we do happen upon someone, or if we know someone who needs this, I think a lot of people think that maybe you have to call 911 to get this. Or I know our police department here now has it on board with them all the time because they run into so many situations. How does someone go about getting it? I mean, do you have to have training or testing, or how does that work?
So anybody can get it. First responders do all have it, but there is a time component. It takes time to get there. So administering as fast as possible, of course, is the goal. So anybody can get it at a pharmacy. You don't need a prescription for it. The pharmacist has a standing order, and you can get it from a pharmacy. Insurance will cover it. If you have a prescription for an opioid, you should also have a prescription for Narcan. And if you don't have insurance, or if you don't qualify to have it in another way, each county in the state has something called a regional overdose prevention specialist. And their goal is to get out as much reversal medication as they can. We do have information on our website. Our grant, we have a grant, and we're trying to promote the use of Narcan through that. We have the information about the ropes coordinators on our website. They have their own website. It has the contact information. You can contact them directly and get training as well as the medication.
Okay, so there is a little bit of training, because you talk about how easy it is to administer, but a lot of us are like, well, I've never given anybody any kind of injection or anything. So, there's always that nervous part. But if it comes to saving someone's life, is there any place in particular that you have to inject the Narcan?
Well, there's different types. So Narcan is the brand name for the nasal spray. So you're not injecting anything at that point. There is injectable Narcan, naloxone, which you would want to give in the outer thigh, that big muscle and the biggest muscle in the leg.
Mm-hmm.
But the Narcan that you would get from the ropes coordinators or your pharmacy is going to be a nasal spray. So you pop the top off, you put it in their nose, you push the button. That's all you do. You're not injecting anything. So it's very easy. There is some training that goes with it. But that's basically how you administer it.
Mm-hmm.
We like people to know other things about, how to keep the patient safe. Well, I call them patients because I'm a nurse. How to keep the person safe until medical help arrives. They might need another dose, when if you need to give another dose. So there are some things we do want people to know,
Mm-hmm.
but actually administering it is very easy.
Now, you talked about how time is of the essence when you're in a situation like this. How much time does someone have when they realize that someone has OD'd and to administer this?
It really depends, because they might still be breathing but still need it. It depends on where the person is. Do they still have a heart rate? Are they still breathing? That kind of thing. So I can't give you a definite answer on that. It really depends on the patient, how much opioids are on board, what medications they've taken, that kind of thing.
Mm-hmm.
But as soon as possible.
Oh, yeah. Once you realize that's it. So that's why it's so important for everyone to have it. I found that interesting. All of us, even if you do not know that someone is in your family or in your vicinity at work or wherever who may need this because they could overdose on this. If we all have it at the ready, like you said, in the dash of your car or in your handbag or whatever, that you can administer it if it is needed. So that's great to know, because we need to save lives. I mean, we are losing so many people to overdoses.
We are. And since the pandemic started, we don't have the numbers right up until now, but from September 2020, the 12 months prior to that, there were close to 3,000 overdose deaths. That's not counting the ones that survived.
Oh, my goodness.
From the year before, we were around 1,800 a year for the year or two before that. So we've seen a drastic increase since the pandemic. And, of course, those numbers aren't getting any better right now. So we definitely are trying to get it out into the community more than ever.
Well, then I'm glad to be a part of getting that out there. Jennifer, you all have a program called Staying Alive Fridays. Talk to us about that and how people can get involved.
We do. So Staying Alive Fridays is Narcan training. We have a grant, a UT grant. It's the Rural Communities Opioid Response Program grant. And as part of that grant, like I said, we're trying to increase getting Narcan out into the community. So Staying Alive Fridays is done by a pharmacy professor that we have that works on the grant with us. He is a ropes coordinator, and it's the second Friday of each month at noon. It's virtual.
Mm-hmm.
It teaches you what Narcan is, how to identify an opioid overdose, what to do in the case of an opioid overdose, how to administer the medication, the after effects, and all of that, and also how to access the medication and get that for free.
So the second Friday of every single month, noon to 1 p.m., it's virtual wherever you are. We're all so used to signing on to Zoom links now for most meetings. That should be a really good lesson for any of us. Any of us can get on there. And then you say that's also distribution. So is that where they've learned where they can get it or how to get it?
They can. So that will be through the ropes coordinators for each region, and the contact information is in there. And some people will qualify for it on their own. They can go to their pharmacy and get it. They might have other routes, and they don't need to get it from the ropes coordinator. But if they qualify for that and that's how they need it, the contact information is there. They can reach out to them. They can get the medication to have.
Now, one more time, you said we can get the Narcan from our pharmacy. Do you just, if you don't have a prescription, can you just walk up and say, I have a concern, I would like some Narcan? How does that work?
Mm-hmm. You can, and as long as they have it there in stock. Otherwise, they might need to order it. But yes, and then as long as they have it in stock, the pharmacist can give that medication to them.
So the bottom line is we can all be a part of saving lives of people who have opioid addictions and may overdose, and we can be a part of bringing them back from that overdose and possibly getting them help to where they get back on track, to where they can have some healing from that addiction. Jennifer, I appreciate you being with me so much this morning. I mean, this is some great information. I hope a lot of people have learned, oh, this is something I didn't know. Hopefully they know this is much simpler than I thought it would be, and that you really do have some control of helping your loved ones, family members, or a stranger if you come upon an overdose. So thank you so much. Once again, remember the Staying Alive Fridays, and that's every month through the end of the year. And it's the second Friday of every month from noon to 1. So you can get more information on the website. Can you give us a website, please, Jennifer?
It is. The website is tnopioid.utk.edu.
Thank you so much. We appreciate you. This has been the East Tennessee Report, a public affairs program of the Summit Media Corp Knoxville Radio Group. I'm Kim Hansard, and I've been talking with Jennifer Tourville, who is the UTK College of Nursing and Director of Substance Misuse Outreach and Initiatives for UT System. Lots of good information. She gave us the website there. You can get online and learn more about Narcan and how we all can have a part in saving lives. Thank you for joining us. Make it a great Sunday.